The Montana Television Network. This is the 10 o'clock news on Q2, Montana's news leader.
Today I'm furthering our efforts to prepare by issuing an executive order declaring a state of emergency in Montana.
A state of emergency now in effect as cases of coronavirus spread closer to Montana. A domino effect as fears shut down schools, sporting events, and amusement parks all across the country, the state, and our community. Good evening, everyone. Thanks for joining us. Russ is off tonight. I'm Jeanelle Slade. Governor Bullock getting out ahead of any confirmed COVID-19 cases here in Montana. The governor addressing Montana late this afternoon, calling this a dynamic and evolving situation. He also made it clear that all patients tested so far have come back negative for COVID-19.
Now is still the time to continue to plan, not panic. Just like we do with any challenging situation when it hits our communities, we stick together, we make sure that we mitigate the impact, we have an appropriate response, and do all that we can to slow the spread when it comes.
Now, the state, which has a capacity to test 2,100 residents, has provided a phone number if you have any questions. That's 1-888-333-0461 or online at covid19.mt.gov. Well, more than 1,600 cases have been confirmed in 45 states and Washington, D.C. The death toll now tops 40 across the U.S. And today, more and more closures and cancellations. Danya Backus reports.
As authorities race to contain the coronavirus, public events across the nation are being canceled. Nearly all major sporting events have been called off, including March Madness.
I would rather it not be canceled, but possibly rescheduled. I heard one of the commentators say this morning possibly a May Madness would work. That would work for us.
The NBA, NHL, and Major League Soccer have suspended their seasons. Major League Baseball is suspending its spring training. Broadway is going dark. And California's Disney resorts are closing down starting Saturday until the end of March.
If Disney's closing, you know it's bad.
All schools in Ohio, Maryland, and the cities of Atlanta and San Francisco have been ordered closed. The pandemic is also taking a toll on the stock market. Wall Street just had its worst day since the 1987 crash.
It's going away. We want it to go away with very, very few deaths.
President Trump continued to downplay growing fears, saying he is considering declaring a national emergency under the Stafford Act, which would free up more federal resources. Danya Backus, CBS News, Los Angeles.
And the administration's top infectious disease expert says a system of broad screening should be up and running by private sector labs in a week. A local Billings doctor says about 80% of people who come down with COVID-19 will make it through just fine. While there is no medication, about 20% may need to see a doctor. Q2's David J. reports.
A temperature of 101.5 degrees is one possible symptom of COVID-19.
The COVID virus, what we're seeing is it attacks the lower respiratory system. You do get a cough, and then as it gets more severe, people start experiencing shortness of breath. Fever is very common. Muscle aches are another thing that have been reported with some frequency. But that's kind of the gamut of symptoms that we see with this new coronavirus.
Dr. Michael Bush is the St. Vincent Chief Medical Officer and an emergency room doctor.
The 2009 swine flu, the Ebola, concerns that we had, but this is the first worldwide pandemic in 40 years of treating patients.
So if you do have the symptoms, Dr. Bush has some recommendations on whether you should come to the emergency room or do something else.
If you are feeling like you are very sick, high fever, feeling short of breath, then those would be patients that potentially might need the resources of the hospital. For patients that don't have those type of symptoms but are worried, we would recommend contacting your primary care doctor.
There is a procedure for determining what the patient has.
Once you show up in the emergency department, we would be putting a mask on you, limiting contact. We'd be testing for influenza because that's far more common even today than is the COVID virus. We'd be looking for other respiratory problems and then considering testing for the COVID virus.
Dr. Bush expects that a vaccine or antiviral medication is 18 months away.
The treatment for this virus is symptomatic treatment, so it's supportive treatment. We're providing oxygen if you need oxygen, helping maintain fluid status and those type of things.
And St. Vincent has some restrictions at the hospital to limit the spread of COVID-19.
We're asking people under the age of 18 not to come to the hospital. We're asking people that have any upper respiratory symptoms, cough, cold, fever, any illness, not to visit the hospital. Bump arms, wash your hands, cover your cough, stay 6 feet away, and make sure that if you're going to a group function, that it's something you really should be going to.
In Billings, David J., MTN News.
Thanks, David. And Dr. Bush expects COVID-19 to show up here in Montana in a few days. He says it will likely happen what has happened in nearby states with someone getting the virus while out traveling and then coming back to the state. Now, faculty and staff will report to class, but students at Montana's 16 state colleges will not. All of the state schools will transition to online classes on March 23rd. The Montana Commissioner of Higher Education, Clayton Christian, says the decision was made in partnership with the Board of Regents and applies to all state campuses. Now, campuses will remain open for dorms, dining, and services, including computer labs. Now, the directive also states that all state campuses will implement appropriate social distancing measures in line with CDC guidelines and recommendations. And students at Rocky Mountain College in Billings will move to online classes even sooner. Late this afternoon, administrators there announced they will extend spring break 2 more days and then start online classes on March 18th. Rocky residents and food halls will remain open. And for those of you hoping to celebrate St. Patrick's Day this weekend, just tonight, the Downtown Billings Alliance announced the annual parade and Celtic Fair this Saturday is canceled. Also falling victim to coronavirus concerns, the Montana State Spelling Bee in Bozeman on Saturday is suspended until further notice. But still moving forward, the Boys and Girls Clubs of Yellowstone counties will be there. The Bee Great Ball will go on as scheduled tomorrow evening at the Billings Hotel and Convention Center. Extra precautions are being made. And now turning to Chief Forecaster Bob McGuire. Bob, it feels like winter is officially back in Montana. It also brought with it a lot of watches and warnings.
Yeah, we may be giving you a good idea to stay inside, and this will be a good reason for it. Let me start off with the threat board. Look at that. All across the northern part of the state, we have something going on. Let's start off with the pink stuff. That is the winter storm warning. Look at all the different snowfall amounts. And plus, we're looking at 40-mile-per-hour winds causing a lot of blowing and drifting snow. But anywhere from like 3 to 6 inches of snow by Great Falls, all the way up to 16 inches by Glacier National Park. From Havre on down to Lewistown, could see 6 to 12 inches of snow there. All around that, we have winter storm watches and winter weather advisories. Northeastern Montana could see 3 to 8 inches of snow there. In Muscle Shell County, more like 4 to 6 inches by Butte. Into Helena, 2 to 5 inches of snow there. 1 to 3 by Kalispell, and 5 to 7 inches of snow up by Missoula. And then you'll notice here, we're looking at small stream flood advisories for Phillips Valley and Sheridan counties. That's because of the runoff from a lot of snow melt. It's filling up the streams and rivers there. And for the Billings area, let's talk about how much snow we could see out of this. These are all of our snowfall computer models. We like the one in the middle, so right now it looks like it's going to be the Euro. We're looking at maybe 1 to 2 inches of snow by the time the end of the weekend is here. We'll have more on that coming your way in a few more minutes. Jeanelle?
All right, thanks, Bob. An agreement announced today allows Montana to enforce environmental laws while the Navajo tribe operates the Spring Creek mine in Bighorn County. The tribe had claimed sovereign immunity, but with a durable limited waiver of sovereign immunity, the Department of Environmental Quality and other agencies can enforce state laws. The DEQ also accepted the Navajo Transition Energy Company based in New Mexico as a contract miner for day-to-day operations. In October, the company took ownership of the mine from bankrupt Cloud Peak Energy Resources. The DEQ also issued a final environmental impact statement on the proposed 977-acre expansion within the mine's existing permit boundary. A final decision on the project will be issued within 15 days. Still to come on your 10 o'clock news, a Montana veteran takes to the mat in order to help others deal with mental health issues. We'll have that story next. And in sports, while much of the sports world has gone silent, state tournament action is in full gear across Montana. Scott will be in with all the high-flying highlights.
You're watching MTN News with Jeanelle Slade. and Russ Riesinger. Storm Tracker weather with Bob McGuire. And sports with Scott Breen. This is the 10 o'clock news on Q2, Montana's news leader.